Hi, it's Dr. Lewis Clark here again with my assistant Matthew talking about shoulder problems. I want to show you the most common reason that we see shoulder pain and shoulder problems in our office, and it's called impingement syndrome, or sometimes called rotator cuff syndrome or rotator cuff problems. First of all, the rotator cuff is a group of 6 muscles in the shoulder that actually hold and stabilize the shoulder. The shoulder is a very complex joint because it has such a massive range of motion, and then still at the same time it has strength. And so there is not a lot of ligaments that hold the shoulder in place. It is done by different muscles working in conjunction with each other to allow movement and still strength. So the most common impingement syndrome is the supraspinatus muscle or tendon that's coming across the top of the shoulder. It is actually on top of the scapula, the flat bone here in the back, but it comes around and inserts around on the top of the humerus, the arm bone. And so a lot of times, here's what it will look like. When you go to raise your shoulder a certain way, it will catch, lock, or hurt. Sometimes you might reach out for something and it might do the same thing. And here's how you can test it. If you have someone just stabilize your shoulder like this and then raise your arm up, and if that begins to catch right there and it won't go any further or starts to hurt, you have an impingement syndrome. Whereas if it's normal, you can hold this and it will go clean through all the way to the shoulder, which is what it should do, okay? And sometimes it might clear, but you might feel it kind of grinding, or it might hurt, or it might pop or a little. And that means that you are having an impingement. It just hasn't gotten completely severe yet. So that's impingement syndrome, okay? And it can be in other muscles as well, but this is the most common. I hope this helps you. The next series we're going to talk about rotator cuff injuries and which ones are involved. So stay tuned. God bless and have a great day.